This is an X-ray of chest. So what do you see here? What do you see here? That there are multiple rib fractures in this X-ray. You can see clear cut, right?
Yes.
And they'll find the fluid level also underneath. That means this person has met with some kind of a trauma, injury, fractured his ribs, which has resulted in hemothorax. Hemothorax means there is a fluid in the peritoneal cavity. And not only that, besides, what else you find? You find radiolucent shadows in the soft tissue. This is surgical emphysema. That means there is some kind of an injury to the lung and air has entered into the subcutaneous tissue. When air enters the subcutaneous tissue, this is called surgical emphysema. And surgical emphysema, the part is swollen up and there is a crackling sound on palpation. So hemothorax means it is one of the life-threatening conditions. The bilateral hemothorax, it may immediately life-threatening chest trauma. And massive hemothorax means a person has got more than 1500 ml of blood in the pleural cavity, or you drain more than 200 ml of blood every hour, or 1500 ml of blood in the 24 hours is called massive hemothorax. Now once there is a chest trauma, it can be what? It can be stove-in chest also, and it can be, what else it can be? Flail chest. What do you mean by flail chest? Flail chest means that a person segment, the ribs are fractured. Multiple ribs are fractured as multiple segments, or at least two segments. That segment will become a flail segment. And there will be paradoxical breathing, that when the person is breathing inside, the flail segment will move out inside and out. When a person is breathing in, the flail segment will move in. And when during expiration, this will move out. Paradoxical breathing. So therefore you have to stabilize the rib fractures. Either you apply some kind of a thing, or you do some open reduction in thing, or person should be put on ventilatory support and should be knocked out. So therefore, otherwise, if the patient is kept as such, he will not be able to breathe and he will go into respiratory arrest. Now what do you find here? This is another X-ray chest. He too has got multiple rib fractures. See here. There are multiple rib fractures here also. And there is surgical emphysema here in this patient also. And there is a intercostal tube drain which has gone into the pleural cavity. What is the safest place for putting the intercostal tube drain? The intercostal tube. Yeah, there is a safe triangle. The safe triangle is the lateral border of the pectoralis muscle. The line drawn at the nipple, almost the fifth intercostal space, and mid-axillary line. This is the safest place. And here you see the intercostal space. The intercostal tube drain has gone inside. The eye of the intercostal tube drain should not come out, otherwise this will keep on leaking. And this tube should be connected to an underwater seal so that no air goes from outside to inside, right? And you remove the drain after the patient's drainage has come down and lung has fully expanded. Alright, now let's move over to the other side. Now here you find an X-ray chest and abdomen. What do you find? There is a gas under the right dome of the diaphragm. The gas can be under the both domes of diaphragm, even. And this occurs just because of the perforation of the gut, perforated renal by and large most often. And this radiolucent, crescent shaped gas shadow under the dome of diaphragm here. See, this is called cupola sign. What is it called? Cupola sign. C-U-P-O-L-A. Cupola sign. So that first it means that there is gas under the dome of the diaphragm. There may be perforated duodenal ulcer which requires a surgery. And let us see this thing also. What is this X-ray? Quite unusual. The X-ray is upside down. Please close the door. There's some noise coming. What is this? Why this X-ray is upside down? Is it normal? Yes, this is an invertogram which was being done in old times in babies which are born with imperforate anus to find out where there is some kind of anorectal abnormality. You see, what do you find here? There is a quine shadow, there is a marker at the region of the anus, and you see that if the gas goes right up to this marker, that means low anal is maybe some kind of a membrane, anal membrane, you know, which has closed anus and baby has not passed the meconium or something like that. But in case of high anal agenesis, what you call anorectal abnormality, the difference between the quine shadow and the gas shadow is about 2.5 centimeter. Patient may require 2 stage surgery for his initial colostomy and thereafter, you know, and repair of the ageneric segment. There so many operations are available for depending upon the abnormality. There may be fistula even with the vagina and bladder or things like that. So anorectal, this is called a invertogram, but these days this is not being used. You can do it in a, you know, in a lateral position also. Yes. All right. I think this should suffice for today. Okay, thank you.